Welcome everybody to a new session of our webinar series on data science and statistics. Today we have the pleasure of welcoming André de Carvalho, who is professor and current dean of the Institute of Mathematics and Computer Science of University of São Paulo at São Carlos in Brazil. André has many different positions. He coordinates the Brazilian Applied AI Research Center for Smart and Sustainable Cities, the National Science Technological Institute of AI for Social Good, and the EMBRAP Unit of Data Science at ECMC at the University of São Paulo. He's a member of the Computer Science Advisory Committee of the Brazilian National Council for Scientific and Technological Development, that is CNPq, of the Steering Committee of the International Network for Government Science Advice, of the Latin American and Caribbean chapter, and of the UK Expert Advisory Panel for AI Safety Report, and chair of the Working Group on Machine Learning and Data Mining of the International Federation for Information Processing, Technical Committee on Artificial Intelligence. André has also been Vice President of the Brazilian Computer Science Society for 2 terms. Today, André will talk to us about artificial intelligence for smart cities, focusing on public health. Thank you very much, André, for having accepted our invitation. We are looking forward to your talk, and the floor is yours.
Thank you very much, Paul and Eduardo, for the kind invitation. So I'll just go to the talk. I'll start telling a story. In 2019, Brazil had an agreement with UNESCO to define the national AI strategy. And as part of the strategy, there was a proposal for a national call for some applied AI research centers. The idea was to fund 8 applied AI research centers. Now they are funding 12 because they expand the number. In the first call, they are supposed to select 4, and they select 6 in the end, in one of 4 different areas: health, agriculture, industry, and smart cities. In the end, they selected 3 in healthcare, 1 in smart cities, 2 in industry, and no proposal in agriculture. And on the right side, I have a Portuguese part of the call. So one of the centers selected was called IARA. IARA is a national center for applied AI for smart sustainable cities, and then it became smart sustainable and inclusive cities. And the idea of IARA is, although it started as a center, it was created as there is something wrong here. Yes, as a network, because it had support from 11 Brazilian cities, more than 40 university and research institute with 200 researchers, and some funding agents from different states in Brazil. And also has collaboration with 20 international universities or research centers all over the world, including University of Porto. So these are the institutions that are part of IARA. One of them is called Inmetro, is an institution that measure everything in Brazil, decide the patterns for different measures, but have some universities, research centers. They are in 21 Brazilian states in all the 5 regions of Brazil. Here are the international collaborators. So one of them is the University of Porto, Portugal. In Portugal, have University of Porto, University of Aveiro, and Nova de Lisboa. And these centers, they have a different idea for sponsorship. The funding comes half from FAPESP and the Ministry of Science, Technology and Innovation, and CGI.br, which is responsible for the University for the Internet Domain in Brazil. And the other half comes from companies. So you have some funding from Intel, DaSSWeb, IPEC, Stellantis, Splice, and Jacto. Splice is a Brazilian group for telecommunication and for roads. Jacto is an agriculture company. And Stellantis is a combination of 2 big companies for the automobile sector. It was FCA and Peugeot Citroën that created the group called Stellantis. It also has a support from different Brazilian cities. I'm showing this map where are these cities. And I'll start talking about the project that we are carrying out in 2 cities. in Canaã dos Carajás, in north of Brazil, in the state of Pará, in Guarapuava, in the south of Brazil, in the state of Paraná. Everything you do, you follow the ODS from United Nations because EIRE was created to be sustainable. Just hit here. We are also in charge of a platform which was created in Brazil by the Minister of Science, Technology, and Innovation. At the time, they had communication as well, together with the Minister of Regional Development. The idea is to have a platform to evaluate how intelligent are the Brazilian cities, the maturity regarding intelligence, the maturity level, and it was proposed following a policy by United Nations in a committee which is led by ITU, which is International Technology Union. We propose some key performance indicators to evaluate smart cities all over the world. So we instantiated these indicators and created a set of indicators from Brazil. And now this platform is being managed by IARA. So to have 7 levels of performance indicators, the original proposal have 5 from the United Nations. The situation in Brazil is it's not in the same patamar, in the same platform as in Europe or United Nations. So we have to create 2 new levels of the evaluation. And evaluation in 4 different dimensions: economic dimension, socio-cultural dimension, environment dimension, and how well the cities are managed by the city hall. So these are the different levels. The initial level is when the city say that want to become part of the platform, and the top level is optimization. Even the city is very mature, it can start contributing to other cities in Brazil as well. So this is what is evaluated for each axis. Some indicators are evaluated by more than one axis. Is the case of water and sewage. So you have economical, environment, social, cultural, and then you have this axis which responds to evaluate how well the city is being managed. To evaluate the strategy of the city, the infrastructure provided, the data policy for the city, the services that are available for the citizens, and how well the city monitor all the services that are provided for the population. So this is one kind of the interface of the results that is provided by the cities in the platform. In this platform, we have data from all Brazilian cities, which are around 5,500, and you are also collect some additional data from public platform. All the data you use are public data that have been validated by some governments, ideally by the federal government. So you can be more realistic when you give the maturity level for Brazilian cities. As I mentioned before, the first city starting doing projects with IARA was Canaã dos Carajás. Canaã dos Carajás had the largest open mining in the world for iron. The idea was to create some applications. Most of them use artificial intelligence to improve the quality of life of the citizens of Canaã dos Carajás. Canaã dos Carajás received a large amount of royalties from the mining from a company called Vale because of the size of the iron mining in Canaã dos Carajás. And the mayor of the city decided to take part of the money and put in a fund to think about the city when the mining stops on the normal iron to justify the mining industry. So for them, we have applications like an app for smartphone for citizen engagement. You have donated a car, automobile from Stellantis to use the car as a mobile sensor to investigate the conditions of the streets or the pavement, to evaluate the quality, and to improve the safety of bicycles and pedestrians and all motorcycles as well. We also use artificial intelligence to diagnose autism in the classroom. Of course, we have the authorization for the parents of the children, and use it as well to prevent leishmaniosis, which is a very common disease in the population of Canaã dos Carajás. So here's what we do for the last applications to identify mosquitoes associated with leishmaniosis. And in Canaã dos Carajás, this problem is a strong problem for 2 main reasons. The first is a large accumulation of garbage on plots of land on the streets, which can feed the sunflies. And the second problem is that you have lots of places of still water where the larvae of the sunfish can proliferate and survive. So the idea is to use this problem is to use a drone to monitor the city, take some images, and apply artificial intelligence to the image to assess some risk situations in the accumulation of garbage and the presence of still water. So I will have some videos here, but not sure if they will be present in the video. But this is the first case to show the presence of still water in different regions of Canaã and Carajás. And these next slides, I have a video which is look for garbage in different parts of the city in real time. The other application I made at the beginning is the app for smartphone to increase or to support, to strengthen the relation between the city and the city hall. So we have an application of where the city, any citizen from Canaã and Carajás can require services and see how the service is being attended. So the citizen can request a service, monitor, and evaluate how well the service provided as well. So these different screens you have for different functionalities of this app. You also have a dashboard, which is in the town hall, where the city can identify the occurrence of the requests from the population and prioritize infrastructure maintenance and then provide some services. So they have different functionalities that can look for regions in the city for services that are more frequently asked for. And with this application, this app, anyone can schedule medical appointments and receive and send to the medical doctors the clinical exams. So it speeds up and facilitates the use of the city facilities by its population. The project is more associated with health, is being carried out in Guarapuava. So Guarapuava is in the south of Brazil. And what I'm doing there is create a healthcare living lab, where for 15 years we're going to collect data from the population. It starts in Guarapuava, but now you are signing a contract for another city in Brazil called Pompeia, Brasilia Pompeia, not Italian Pompeia, to do the same thing. So the idea is to work with rare and complex diseases. I'll say in a few minutes what they are, and to evaluate everyone who is participating in the program by collecting clinical data, physical conditioning, genomic data, and nutrition data. And genomic data is generated from different specificities, like in the beginning of work with cancer. So that's why I have the photograph of the cancer hospital here, to try to predict when someone is going to have cancer in a few years. So we follow 4,500 people for 15 years. Every year, new people will be added. For some people, you'll be removed. You will not be in the system anymore. And what are rare complex diseases? Rare diseases, as the name suggests, are diseases that affect few people of the population. So in this case, they affect less than one at every 2,000 people. Although the disease is rare, the number of diseases of rare disease is not rare. So we are 7,000 reported rare diseases, and altogether they affect 8% of the world population. What's said is that less than 10% of the population receive the treatment for these diseases. Another information about these diseases is that 8% of them have genetic causes, and they are very difficult to detect in their early stages. In Canaã and Carajás, we had a support from some business people, and they are constructing a hospital and a research center. The hospital is practically finished now to cancer, and we are in a very strong connection with this project from IARA. So I mentioned that we are going to look for rare and complex diseases. I'm explaining what are rare diseases now. Let me explain what are complex diseases. Complex diseases are those diseases that are due to a combination of different factors, like genetic factors, environmental factors, and lifestyle factors. And some examples of complex diseases are Alzheimer, asthma, depression, cancer, diabetes, epilepsy, Parkinson, in cardiovascular disease. I put in boldface cancer epilepsy because we're working with two diseases at the moment. As for the rare disease, the earlier you detect, the more successful is the treatment, and they are becoming more common as people are living more. So for each person who is in the group that we are monitoring has to fill a questionnaire, has to also have some exam that should be collected. And as I mentioned before, you also evaluate the daily diet and loss of genomic data and the fitness of the population. Another project we carried out, it was in the beginning, even before the IARA Center, was a project called the First 1000 Days. It's a project funded by Wellcome Leap, which is a spin-off from Wellcome Trust. So the idea is in 10 different countries or regions to monitor 1,000 children, each one, in the first 1,000 days of life. And what we want to do is to monitor the executive function of these children. And why the executive function? Because it's very important to evaluate the cognitive development of the kids, of the children. And also because 20% of the 3 years old population in the world have poor executive function development. And these kids will probably be 80% of the adults will need social and economic assistance. On the right side, I have the universal faculties or medical schools that are part of the project. In Brazil, the project was called Germina. So it was coordinated by a colleague of mine in the medical school. And what we did in Brazil was to collect data, which were clinical data from electroencephalogram, cognitive data, and vision data. We also collect some social data for the maternal care, say how the mother was interacting with the children, interacting with the environment, what were feeding the children, and what was the social support available. We also collect some genetic data, DNA, RNA, and the microbiome from the guts of the children. So this was a multidisciplinary if you for computer science, biology, medicine, nutrition, psychology, among others. One of the results of the project was a news that was published, mentioned that plum was found in the milk of mothers who were giving milk to babies in Brazil. And the presence of plum in the milk would affect the development of these children. And you graduate from children from 3 to 16 months of life. Another project is carrying out with also support from IARA is called LOOPS. The idea is to allow the dentist to make an early diagnosis of cancer. So we are working the project with cancer from head and neck, but I start with cancer from the tongue. So the idea is to use the mobile to take some photographs from the mouth by the dentist and do a pre-diagnosis, and depending on the results, sent to a medical doctor specialized in cancer. So there are different universities participate in this study, and you have some challenges as well. First, you have the benefit. The benefit that by using mobile, we have a low cost and easy to acquire images. And by doing so, also we have a very large data set. The challenges are first the frame of the photo, second, with the brightness variation, and also with the noise handling. Mainly when you use the flash for the cameras. Here's what how we're doing in the project. We are doing also some exams to identify the health of the teeth of the population. So what we're trying to do, you are trying to identify the cancer. You segment the image using machine learning to recommend the best image segmentation technique, then do an image annotation. After the image annotation, then you try to classify the image. And then you validate this image, this diagnosis of cancer, with an expert. Another project I mentioned before is a project for treating the dysplasia. The main dysplasia is epilepsy. This is the most frequent neurological disease in the world. So the estimation of the World Health Organization is that 50 million people in the world have dysplasia. What happens is people with dysplasia, they have repeated epileptic seizures. So that's why they call also epilepsy for the most frequent cases. There are different kinds of seizures. They could be focal, they could be generalized, they could be a combination of both. And what I'm doing here is to identify regions of dysplasia in the brain to support a brain surgeon to remove the area associated with dysplasia. Dysplasia. Why do we do that? Because although there is a medication for dysplasia, 1/3 of the patients do not respond well to the medication. So the only solution for them is the removal by a surgery. So what to do is to try identify what the exact region that should be removed. So don't remove less, neither less nor less, nor more of the area that are needed to be removed. So this is the image that you have access and identify the regions associated with dysplasia. For that to divide the images in small regions and then use a neural network for dispatch to identify if there is a dysplasia or not associated with that particular region, and then try to redo the region with dysplasia. A project started together with IARA is an international project. It has a funding from DRC, which is a Canadian agency, and the idea is to prepare the world for the next pandemic and epidemic using AI. Right? So there are 15 different countries working this project. There are 16 or 15, and each country has a different approach to deal with pandemics and epidemics. In the case of Brazil, we have a tool called Auto AI Pandemics, which is based on automated machine learning to trying to allow people who don't have a background in artificial intelligence to use artificial intelligence for tasks associated with detection and control of epidemics and epidemics. So it's also a multidisciplinary team, and we use AutoML in 3 different situations. One is to monitor epidemic, pandemic, and support some public policies. Another one is to use Omniture data to support the development of drugs and vaccines. And the third one is to use AutoML to identify fake news, deepfake associated with epidemics and pandemics. So this is the landscape of the different countries working in the project. And these are the tools that we developed in Brazil. By AutoML, with AutoML specialized for biology, bioprediction, which is to predict the actual proteins, by diffuse to fuse data from different sources, and also use AutoML to support the design of new chemistry, new drugs, and math feature with structural meta feature from data. And finally, ITT is a tool with identify fake news associated with health. We also have 2 projects associated with atypical growth. One is the University of São Paulo by identify deficiencies in hormones and create a tool to reduce exam costs and allow diagnosis in regions of Brazil that don't have the necessary support. And the other one is to identify atypical growth by using images of children, even the fetus or in the early stage of life. We have another project, which is collaboration with Southampton, which combines machine learning with optimization to have a personalized trajectory in the hospital by patients. So the idea is to define for each patient what will be the sequence of exams, and then you also reduce the time by optimize the sequence of exams that all the patients have to do in the hospitals and reduce costs as well. Also, sort of IARA, I have a project now in the state of Minas Gerais. They have a program called Cities of the Future, and the idea is for IARA to give support to some cities in the state of Minas Gerais. We are also part of an association called Health AI, which is a non-profit association that develops tools, is associated with World Health Organization, based on artificial intelligence to be shared and to be used in different countries in the world. And also are part of an institution called Open Agile Smart Cities. The first one was hosted in Switzerland, this one is in Belgium. We're trying to put together people from computer science and artificial intelligence to share tools for smart sustainable cities as well. As Paula mentioned in the beginning of the talk, we have recently approved the National Institute of Science and Technology is a national call for institutes in different areas. This one is on AI for social good. We are very proud to have 40% of research as women. And this one was around 100 institutes were approved for a call for CNPq. And you are working for different areas: prevention of natural disasters, monitoring the environment, mental health, and social inclusion. And you're also going to present some of the things they're doing in the project at the COP30 in Belém do Pará this year in November. So that's what I want to present. Thank you very much.